Three, two.
And welcome everyone to the Real Leaders Podcast with Keys from Keynote Speakers at the Agents of Change Summit. I'm your host, Kevin Edwards. Joining me today is Dr. Ronnie Zeiger, the Head of Health Strategy at Facebook. Doc, thanks for being with us today.
My pleasure.
So what is Facebook's involvement here at the Agents of Change Summit?
Well, to learn.
To learn.
Facebook, as you know, is not a health company, but we have so many people on our platform, and given the way the world is changing, they're looking for information, they're looking for each other, and we want to understand how we can not only serve their social needs, but also how we might be able to improve public health along the way.
So could you provide our audience with an example of how Facebook is using the data for good?
Sure. So an example of how we can use data for good, as you just suggested, one of our teams, which happens to have exactly that name, the Data for Good team, looks for ways to make use of data sets that Facebook has access to that can be used in service of crisis relief while maintaining people's privacy. So one thing that I mentioned in my talk earlier this morning was after the recent earthquake in Puerto Rico, we used our ability to detect where people have 4G service based on how phones are connecting to our data centers to map where the biggest impacts of the earthquake were on telecommunications infrastructure. And we were then able to share that data with our partners NetHope and with the Red Cross, who then could prioritize where they were working to rebuild infrastructure to support humanitarian workers and, of course, people who are trying to get in touch with loved ones to tell them if they're okay.
Interesting. So there's been a big resurgence of these Facebook groups, ads on Facebook. Now, could you provide us an example about how a Facebook group can be used in a situation like that?
Well, Facebook groups is actually very near and dear to my heart. I'm a physician, and while I grew up in the traditional medical system where all the advice is supposed to come from the well-trained clinicians, one thing that's sometimes missing is the ability to connect with someone else who's been there. So we don't think a lot about how being sick can also be really lonely. And that's something that has fascinated me for a long time. And while Facebook Groups was designed to connect people in the context of whatever they want to be connected about, whether it's a dog lovers group or a baseball card collecting group, we've noticed organically over the years that there's been an increased number of people who use Facebook groups to connect around, for example, rare diseases. Many people who are diagnosed with a less common disease might never meet someone else with that disease. And so we are now putting more thought into making the group's platform work even better for the health context to support people who are trying to learn from each other as a complement to the care that they get from their clinicians.
So you mentioned partners like NetHope and other participating partners in the area, the Red Cross, who came to Facebook to help out. What are some partners that maybe you're looking for, or audience members that are out there that say, you know what, we could partner with Facebook?
It's an important question because most of the good that Facebook is going to be able to do in health is going to require partnership. We're not pretending to be health experts, even if a couple of us there happen to have clinical training. And so I think the best example is probably in the context that we're spending a lot of time on now in trying to combat misinformation, for example, related to vaccines. So we work with global health organizations like the WHO and the CDC who teach us what are the debunked myths and the conspiracy theories that we need to best understand in order to combat them. So I think we're open to ideas. In particular, need to learn from and partner with public health agencies who are experts in their fields and who, in collaboration with the skills and the reach that we happen to have, could hopefully do their jobs even better.
With so much reach, what's the vision going forward for Facebook Health?
I think there's two important parts of it. It's understand the way people are organically using the Facebook platform to find information, to support their health needs. The way, for example, nurses are organizing on Facebook to drive global advocacy campaigns about issues that they care about. We see groups of physicians who are redefining what it means to do continuing medical education. One group comes to mind, a group of hernia surgeons who used to just meet every year in person, and now they meet every day in a Facebook group and share videos and other tips so that they can teach each other new surgical techniques.
Interesting.
And so I think the vision is understanding how the platform is being used and making it work better, and then also doing a lot of work to take responsibility for the ways the platform is being used for less than good purposes, like the spread of misinformation.
Doc, you mentioned learning, now responsibility, some quality traits of leadership. To you, what is your definition of a real leader?
Still trying to figure it out. I think parenting has taught me a lot about that. I would say that the ability to listen and challenge your own assumptions so that you can become a better collaborator.
Wow, I like that a lot. Well said, Doc. Appreciate you coming on the show. For Dr. Ronnie Zeiger, I'm Kevin Edwards, asking you to go out there and keep it real. Thanks, Doc.
My pleasure. Thank you.
All right, folks, and thanks for watching this episode of the Real Leaders Podcast. If you want to learn more from leaders like this interview and you just can't get enough, go online to real-leaders.com/subscribe and get your first magazine for free using coupon code PODCAST25. That's PODCAST25, getting your first magazine for free on a 1-year subscription. We'll see you there.